Thanks for listening to the Business Spotlight podcast presented by the Lancaster Fairfield County Chamber of Commerce. I'm Logan Weaver, the marketing coordinator for the chamber. Thanks for tuning in to a special episode today. We are on location for the first time as we are visiting ClearSky Rehabilitation Hospital of Lancaster, and I'm joined by their CEO, Steve Sprockett, today. How's it going, Steve?
It's going well, Logan. Thank you for the time and the introduction.
And hopefully by the time this episode releases, you guys will be having your grand opening and ribbon cutting and open house the same day. So for those who don't know about ClearSky, they've been seeing the construction going on for the last few months. You guys are finally open. So tell us a little bit about ClearSky Rehabilitation Hospital of Lancaster.
Sure. I appreciate the time again and the opportunity to serve this community. ClearSky Rehabilitation Hospital of Lancaster is a 36-bed inpatient rehabilitation hospital, specific level of care between an acute hospital and home. It's an opportunity for individuals that have had issues with their health, including debilitating events such as stroke or traumatic brain injury, to come to a place for a short period of time, 2 or 3 weeks, and do intense skilled rehabilitation, all under the supervision of physicians, nurses, pharmacists, and other healthcare providers.
A couple of us at the staff got a chance to tour the facility a couple months ago and got to see the full extent of everything you guys offer. And in case you don't know, for those listening, where ClearSky is located, right here in Lancaster, just off of River Valley Boulevard, across from Target. It used to be part of the FMC family. They sold the building, and you guys have been renovating it for, the last year plus. I remember I was here for the groundbreaking when you guys added the extensions. So it's been a minute. And Steve, you've been with the organization for about a year now, I believe.
About 6 months. 6 months
about
in
6 months?
And really enjoying the opportunity to be here in Lancaster. I'm from Central Ohio. I've been here for over 20 years.
Okay.
Originally from Youngstown area. My background is as a physical therapist, so I'm a clinician by background. Enjoyed healthcare in a variety of different environments. But inpatient rehab speaks to me. It's an opportunity where you see patients come in after the worst part of their days, like I said, after that stroke event or debilitating event. And within a short period of time, these people really get a lot of good care. The patients really excel and get back home, which is really important to us. So, yeah, the $41 million commitment to the community has been beneficial. This level of care. There are a few of these type of hospitals in and around Columbus, but nothing in Southeast Ohio. So we're happy to serve individuals here in Lancaster and Fairfield County, all the way down to Athens and down to the river, up to Zanesville, really all of Southeast and Southeast Ohio really needs this level of care to put individuals back on track as they start the recovery process.
Kind of talk a little bit about what inpatient rehabilitation is and what makes you guys different from, say, a skilled nursing facility.
Yeah, that's a great question. So what we're looking at is a different level of care than most people are familiar with. If you were to go into the hospital with a debilitating event after a motor vehicle accident and trauma, stroke or brain injury, spinal cord injury, these patients really don't have the opportunity here in Fairfield County and Lancaster specifically to rehabilitate. It's go to a larger systems like Columbus or go to an individual location like a skilled nursing facility. As a physical therapist, I started my career in skilled nursing facilities, so no bad blood there. I understand the dynamic there. It's just a different level of care. So we have 24/7 RN coverage. Our ratios are 1 nurse per 6 patients. We have daily physician visits from our internal medicine doctors. Our physiatrist, our medical director, or a physical medicine and rehab doc has to see the patient 3 times a week, which is great. And then high-intensity, high-skilled therapy, over 3 hours of therapy a day is given between physical therapy, occupational therapy, and speech-language pathology. So we have those services and then a bunch of other ancillary services such as registered dietitian. We have respiratory therapy. We have an in-house pharmacy. And like I said, a variety of individuals that really look at a holistic approach of recovery after a debilitating event.
And you mentioned that you have a background as a clinician. What are some things that you wish more people knew about IPR?
Yeah, inpatient rehab, like I said, it's not a new level of care. It's just not as widespread as an acute hospital or as a skilled nursing facility. There are over 800 inpatient rehab hospitals throughout the country, but these are usually smaller facilities, mostly licensed as acute hospitals. Like I said, with the nursing and physician coverage and the medical complexities of patients. But I wish the community here would know is we're here to serve the community after those life-changing events, A lot of people don't know the resources that are available to them. Today's part of the opportunity to share that message in the community to say, look, inpatient rehab is a specific level of care for a short period of time, 2 to 3 weeks, of a lot of care given to you, a lot of opportunity for our case managers and other healthcare professionals to put you on the right track of success as you recover from some pretty terrible days. Yeah.
So kind of walk me through the process. What are some of the types of diagnosis that you guys typically see from new patients, such as, they're just getting out of the hospital, but they do need that IPR level of care. So kind of walk me through that process of what you guys typically see.
Sure. We really focus on neurodegenerative processes, including things like Parkinson's disease, multiple sclerosis, ALS. We have other things like Guillain-Barré, those kind of neurodegenerative diseases. We talked about stroke already several times, so hemorrhagic or ischemic stroke. We talked about traumatic brain injuries, right, from head trauma, gunshot wounds, whatever it happens to be. And we've talked about spinal cord injuries. Those are pretty big ones for us. But we see other individuals, multi-traumas. We see amputations. We'll see some complex orthopedic events, let's say complicated total hip replacement. Those type of patients, we'll see those as well in this level of care. Again, 2 criteria you need to meet to kind of come into our facility. 1, do you meet the medical complexities of inpatient level of care, right? That doctor and nursing support quite frequently, if not all day, every day. And then can you tolerate the 3 hours of intense rehabilitation a day? Those are kind of the factors we really want to focus on, and those are the type of patients we want in this environment. Now, when I say intense physical therapy, most people think, hey, Steve, are you going to hook me up to a treadmill and push start and push and see in 3 hours? No, I'm not going to do that. The opportunity here is really saying, hey, we're going to help you with your activities of daily living. Can you get yourself dressed? Can you brush your teeth? Can you comb your hair? Can you get out of bed? Can you get on and off the commode? That is things that you and I take for granted that individuals just had a stroke really struggle with. So
and things that happen on a day-to-day basis. Like you said, we don't really consider that as part of our day-to-day lives because it just comes naturally. But when you have an incident like that, it can really be a setback.
You got it, Logan. And having that flaccid paralysis or maybe not ability to move your arm or leg changes the way we do things, right? Changes the way we pull our pants on, changes the way we get in and out of the shower, into the commode, in and out of cars, those type of things. So a lot of our focus, energy, and rehabilitation care is function-based. Can you get back to activities of daily living you like to do? Cooking, cleaning, getting yourself dressed, all those things, as well as the increase in strength and range of motion, some of those other areas. And a lot of things individuals after stroke need, and maybe the community doesn't realize, is there's cognitive deficits and maybe even swallowing deficits. So having speech-language pathologists here as well, part of the team, huge resource for this community, and individuals to be able to eat a normal texture food, to be able to articulate and communicate effectively, are all part of the rehabilitation process.
That's one thing I noticed, especially when you mentioned the whole day-to-day functions, the things we take for granted. When we did the tour about a month ago, that's one thing that I noticed is that depending on the level of care, there are some rooms that just look like your everyday, kind of like a small 1-bedroom, or maybe even like someone's living room where you've got the restroom, you've got, full TV and bed, couch, that whole setup. And I think that's good practice for folks who, like you said, are going through this process of trying to relearn day-to-day functions. Yep. And what better way to relearn that than in an environment that they may be coming out of, like their typical home environment.
Sure, yeah. And for the bigger part of our hospital, it looks like a hospital, right? Hospital beds, large doors, maybe the railings next to the commode, those type of things, which make it safe for individuals to start that rehab process. But the location you're talking about, we have a 5,000 square foot therapy gym with 1,000 square foot activity daily living suite. So the activities of daily living, cooking, dressing, cleaning, it basically is a small apartment we have here in which we help individuals practice those dynamics. So you'll see a tub that just looks like the tub in your house, not some special hospital tub, but the bathtub, the commode, those are things that you want to work on in our area to kind of practice. Can I get in and out of a regular bed versus a hospital bed that articulates up for me and makes it easy? Those are things we'll work towards.
How does one get a referral to become a patient at ClearSky?
Yeah, majority of our patients do come in from acute hospitals. That would be our clinic liaisons communicate with the case management team and physicians at an acute hospital, such as Fairfield Medical Center, Riverside, Grant, anything like that. But that's not the only avenue. That makes it easy for the physicians and case managers and nurses to talk to one another. But we accept patients from all areas of community. So whether it's a skilled nursing facility, an LTAC, which is a long-term acute care hospital, those are people that are really, really sick. They need a lot of medical attention. Maybe they're a little bit more stable now and can tolerate the extra therapy that's needed. And then from the community, if you're at your physician's office and your physicians notice a decline and you're having some medical complexities that might be managed in an inpatient setting for a hospital, those are individuals we'll take, like I said, from all different areas, a physician referral required, but at some point we just communicate to your PCP if needed.
Now, once the patient gets here, how physically fit do they have to be in order to go through the therapy?
Yeah, that's a great question. A lot of people think, oh, geez, I have to do all this therapy. In reality, we're active throughout the day. So I equate it to a school-based function where you get up, you get yourself cleaned up with occupational therapy. You go down to our dining hall. It's really important to be up vertical. We're not going to serve you meals in your bed. You're going to come to a dining hall just like you'd come to your kitchen at home. You eat your breakfast and then maybe you get a little rest. And then early morning, you would get some physical therapy, a little rest, lunch, and then some occupational therapy or speech therapy or maybe some more PT in the afternoon. So it's very school-based essentially of rest breaks, meal breaks throughout the day. So you'll be kind of active as best you can, 8 to 5.
And it's good to have that routine, especially when you're in that physical therapy, because, retired at home or depending on what they've been doing before coming to ClearSky, they have their own routine, whether that's going to work or, being at home or anything like that. You have your own kind of built-in routine. Yep. So when you come here, it's not like, well, maybe we'll do this or maybe we'll do that. No, it's a pretty strict schedule.
Yeah, we get patient engagement day one. Our case management comes in, does an evaluation. Nursing comes in, does the evaluation. The therapy team and physicians all come and evaluate the patient. And then the whole way we get input from the patient. Hey, I usually get up at 4:30 in the morning. I'd like to get up early, get moving. Could night shift get me up and help me with breakfast early in the morning? Yep, we'll accommodate to that. We'll do our very best to accommodate the individual's needs. And again, kind of getting in that routine is important. Rest is important. Our food and nutrition services are important for our patients. So we want to make sure it's again that holistic approach to care of just not the intense therapy, just not the pharmacy and medical support, really taking care of the whole patient.
Yeah, during that tour, I noticed that some of the rooms have a whiteboard in some cases, and it has a checklist of, whether the patient needs to hit those goals or, the staff, just to make sure everyone's on the same page. So It seems like between the staff and the patients, you guys have a pretty clear communication, and I think that can help build, because if the patients are trusting the staff and the staff is having that, set goals to be able to help that patient, get home eventually,
sure,
then I think that's a pretty good setup there.
Yeah, and it is a collaborative approach, and our case management team does a terrific job of focusing efforts on what the patients need. So at least every 7 days, again mandated through our charter through CMS and other areas, we'll have a care conference. So all the interdisciplinary teams, all the disciplines come together and really talk over the patient's progression, whether they need the medication still, whether their pain level is managed, how they're doing with their voiding schedule and bowel and bladder, the medical complexities of the patients, and then the functional progress of the patient. So that whiteboard you mentioned before is a good communication tool between the patient and the care staff on how much support is needed from the patient, how much we want to promote independence, and the other safety dynamics that are part of the recovery.
We know from, especially folks listening who know Lancaster, Fairfield County, they know how much healthcare dominates the industry here. And especially with you guys coming in, I think that's just another added piece. It's kind of that bridge between, not quite skilled nursing, but it's not quite a full-fledged hospital. You guys kind of fit that little niche. So kind of tell us about why ClearSky specifically chose Lancaster out of anything to build a facility.
Lancaster is such a wonderful community. Like I said, I've been here in Central Ohio for over 20 years and in Ohio and pretty much my entire life. And having this proximity to Columbus is great, but there is a true identity to the community, right? We don't want to be Columbus. We are Lancaster. And I think that's important to delineate. Services going into the big city, you deal with traffic and parking issues and things people just don't want to be a part of. So deliberately, our business development team looked at this market as a secondary market to Columbus as a primary, but also the opportunity to, without the services rendered in many, many square miles. So there are facilities down near the river. There are facilities in Columbus, but really not this level of care for most of Southeast Ohio. So that was the intent, is served and underserved patient population, bridge the gap from an acute hospital to home, with the intent of about 80% of our patients go home. So even before they come in the door, one of our nurses go to the hospital, evaluate the patient, and have clear expectations with the patient to say, yes, your goal is to go home with some help or support. 10% of our patients continue the journey of rehabilitation, maybe in a skilled nursing environment. And then 10% may unfortunately have an exacerbation of their event, maybe a secondary stroke or something like that. So some do go back to the acute hospital. But this level of hospital care is needed, medical rehabilitation, to really get people home and back to their activities they love to do, whether it's fishing, hunting, cooking, cleaning, going back to work. We really work on your specific goals here.
You guys have patients from all ages, as I've seen in some of your materials, but I would say that it probably does skew a little bit more on the older side because that's where, a lot of the needs are based, especially when it comes to, physical therapy, falls especially with Lancaster kind of having an older population at times. Having a facility like that that's close to home too is very important. Now, on that note,
sure,
if someone were to have an medical emergency out of town where they need this types of services, how or can they come back to Fairfield County, come back to ClearSky, come here to get that type of IPR treatment?
Yeah, absolutely. The answer is yes to that question. And that just takes a little bit of communication with the hospital you end up in. So let's say you were traveling for vacation or you were out of town, you had an event in which you needed some medical attention, and the doctors, nurses, therapists decided that the best opportunity is inpatient rehab for you. You could always say, I want to go back to Lancaster, I want to go back to ClearSky, and I want to be able to do the rehabilitation here in town. Because it makes it easier to have your loved ones come and visit, spend some time with you, help you bring you clothes or medication or anything else you might need. And it's really important to say, yep, I want to get back home. Because right now our community has a lot of great resources, like you mentioned, for medical care. But sometimes there's opportunities to go to a higher level of care when you're really having some extra need and support. And if that's the case, that's great. You get stabilized and you can come back home to us, no problem. It's just a quick phone call.
Especially with you guys being so community oriented, especially kind of how you guys kind of build a sense of community here as a staff. I know a lot of people may be asking, okay, let's just say my mom, my dad, or my relative is here. Can family visit?
Oh, absolutely. Yeah. Visitation is 8 to 8, but we make exceptions as well. Especially with a traumatic brain injury patient population, some of those issues are really challenging to work through without family support. So family support is encouraged throughout the day, throughout the weekends. And in certain instances, we'll have some families spend the night and be a support structure for our patient population. So yes, we encourage very strongly in visitation. That engagement with your loved ones helps motivate our patients get better and really gives them a focused effort in returning to home.
Well, Steve, if there's anyone in the community looking to reach out, maybe looking to utilize ClearSky services, how can they do so?
Yeah, feel free to reach out. We're on the web at www.clearskyhealth.com. A great location. ClearSky is an easy search for you. Google search. Our address here is at 1201 River Valley Boulevard. Like you said, right next to Target. Easy to find, right off the main drag here in town, so it makes it great. And the phone number for everybody is 740-303-4300. That'll get you to the main line and get it to our business development team. If you want to take a tour of the facility, if you have questions about stroke rehabilitation or any other rehabilitation services, we're more than happy to answer that. Or if you have a loved one that might need our level of care, please feel free to reach out and we'd help you through that process.
And if you happen to be listening to this episode when it first comes out, ribbon cutting today at 4:00, come on out for the open house and come on out and check it out. If not, as Steve said, reach out to them and they'll be more than happy to accommodate that. Thanks for having me on location. You guys are my test run for on-site locations. So.
This is great, Logan. I appreciate the time. And again, we're here to serve the community And this is a great opportunity just to get the message out.
Well, thanks, Steve. And thank you for listening to the Business Spotlight podcast presented by the Lancaster Fairfield County Chamber of Commerce.